This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today I'm going to talk about the difference between shoulder impingement / bursitis and a rotator cuff tear. So if you like this video, we put out new content weekly, so please like and subscribe. So shoulder impingement versus a rotator cuff tear. So your shoulder is kind of like a golf ball on a golf tee. Your hip is more like ball and socket, lots of coverage, not so much with your shoulder. There's some small muscles called the rotator cuff, and it's four muscles which basically holds that golf ball on that golf tee. Most of the movement of the shoulder is actually caused by the deltoid muscle, which is a much bigger muscle. But the rotator cuff kind of centralizes the head of the humerus, or your shoulder joint, and makes sure it works. So that's your rotator cuff. Above the rotator cuff, there's a space called the subacromial space, and then above that is your shoulder blade. So if you're feeling on yourself, you can feel your shoulder blade. Below that's the space, and below that it's a rotator cuff. So when someone has shoulder impingement, it just means that that space is kind of shortened and it gets really inflamed and sometimes can cause shoulder bursitis. And people have a lot of pain with reaching up or reaching out. But the rotator cuff is not torn at all. Sometimes it's hard to tell without an MRI if the rotator cuff is torn or not, if they have bad shoulder impingement, because they can't hold their arm up because it's so painful. But for the most part, it's a biomechanical thing in the sense that that subacromial space has decreased a little bit. And the best treatment is usually physical therapy to stretch everything out, plus or minus a steroid injection to calm everything down. Rarely it'll go to surgery where somebody doesn't get better and they'll just kind of clean that out with a scope, all the bursitis and everything that's in that space. But mainstay of treatment, steroid injection, physical therapy. A rotator cuff tear means that the tendons of one of those small muscles, so not the meaty part, the kind of white shiny part, the tendon, has torn off the shoulder. And sometimes that can tear partway through, or sometimes that can tear all the way through. And if it really tears through all the way, like pretty badly, the head of the shoulder starts moving upwards and you start getting pretty bad arthritis. So that'll also cause pain with kind of lifting the arm up and using it. But if it's really torn all the way, there'll also be a loss of strength. MRI will tell you if it's fully torn or partially torn. Sometimes people with partially torn rotator cuffs, you can do some rehab and the pain will kind of go away. Some people are doing PRP injections to try and heal those. If it's torn all the way though, really the only solution to that is for surgery to come and tack that rotator cuff back down where it's supposed to be and allow it to heal. But again, with shoulder impingement, it's more inflammation in the space above the rotator cuff, and then as opposed to a tear in the rotator cuff itself. So I hope I was able to answer your questions about the difference between shoulder impingement / bursitis and a rotator cuff tear. If you have any questions I didn't answer, feel free to leave them in the comments below, and I'll do my best to respond, but I can't give you specific medical advice about what you should do in your situation. Again, if you like this video, we put out new content weekly, so please like and subscribe, and thanks for watching.